Good afternoon, everyone. It's July 12th, 2023. I just picked up today's newspaper that was very interesting today, that what we've been talking about over the last few days on the drug overdoses and that. And as you can see, this is our Ottawa Citizen here, and I'm going to read the article that came out in the Ottawa Citizen. And it's on the surge of weekend overdoses, alarms harm reduction group. The CEO of Ottawa Inner City Health, a harm reduction organization that operates supervised consumption sites, says he fears a recent bunch of overdoses could be connected to some shift in the drug supply. And of course that, Julie and I have been talking about something's not right here, possibly in that direction. Ottawa police confirmed Monday that nearly 24 people suffered drug overdoses over the weekend. The Ottawa Police Service said it responded to 19 drug-related overdoses on Saturday and another 3 on Sunday morning. Police said emergency responders and civilians administered naloxone, a drug that reverses opioid overdoses in many of the cases. It's a bit too early to tell what's going on, Ottawa Inner City Health CEO Rob Boyd said. He suggested the cause of the rise in overdoses could be associated with a group of new, inexperienced drug users who are more susceptible to misuse. This again, on this part of it, Julie has been expressing concern because she sees newer and younger drug dealers even coming in to the market area down here. My worry is that this is people who are housed who would not use supervised consumption services, who may not be aware of harm reduction services or what's available to them to keep them safe, said Boyd. He said his group, which is part of an overdose prevention task force alongside Ottawa police, paramedics, emergency departments, and public health officials, didn't see the sudden uptick that police reported over the weekend. Still, its workers responded to 12 overdoses this weekend alone. It's not a huge difference from what we might normally expect on a weekend. Okay. Boyd said harm reduction workers who operate the city's only 24/7 supervised injection site often respond when they learn of overdoses that happen outside consumption sites. He said some drug users have switched their consumption methods, so they are smoking rather than injecting drugs. No supervised smoking services are currently offered in Ottawa. The most recent data from Ottawa Public Health show that there were 117 emergency hospital visits due to opioid overdoses in May, the highest number since July 2020. Last July saw some of the worst outcomes in recent years, with 5 people dying from suspected opioid overdoses in just 1 week and 98 people hospitalized over the course of the month. Health Canada data suggested there are an average of 20 fatal opioid overdoses a day across all provinces and territories in 2022. Government data show that use of all types of drugs resulted in about 18 hospitalizations a day during the same period in provinces and territories excluding Quebec. A year ago, Health Canada established a $40 million fund to help support the response to overdose crisis through a federal substance use and addictions program. More than half of the funding went towards harm reduction and consumption treatment services in Ontario. Neither police nor Ottawa Public Health said Monday if there had been any emergency hospital visits or deaths in connection with the weekend overdoses. So we still don't know about that. But I thought this was extremely important to bring this to your attention, just how important it is for people to understand, even across the country, just how serious the situation is. And what are we going to do about it? Now, I want to bring you back to one of my previous videos. Not too long ago, I was talking to you about do we have enough kits, naloxone kits? Are we carrying enough of them? Now, what I did want to do today, I know that a lot of my viewers are also seniors like myself. Now, we certainly had drugs in the 1960s when we were growing up. We did have some drug overdoses, but nothing like we have today. We certainly didn't have naloxone kits to try and combat this situation back then either. And even though it was at a smaller scale. So today I decided to bring out my naloxone kit. So I want to show this to everyone, what a naloxone kit looks like. It's very lightweight, as you can see. If we took a photo of this and we could put it in windows such as store windows and wherever we need to put this kit, it would be very easily recognizable, and we would have extra kits that could be available for people to use. Now, as for those in my age bracket, let's put it that way, who do not know what it looks like, a naloxone kit looks like on the inside, I'm going to show you. What you have is these two, whoops, so daisy, nothing like dropping it. We have two spray things. You have 2 doses. This represents 2 doses if it's needed. And then again, you have gloves to use if you need them in the kit that's available, and instructions in the kit as well. What I'm seeing is that this is really a good idea to carry them. Julie has also got a hold of one, and she's going to be carrying it, the same thing as I am, just in case of an emergency and we need an extra naloxone kit for emergency services or whoever needs them at the time. So I'm trying very hard to help people out and certainly try and prevent as many deaths as possible. But when you look at, there's only 2 doses in that, and the situation is so bad that in some cases with the drug supply that's coming in is very dangerous. We're now hearing rumors again that it's being mixed with something different again that's still very dangerous, and quite often now is taking more than the normal 2 doses from a kit. So again, I urge people to find ways of carrying one of these on them. It's easy to slip in your glove compartment. If you're not downtown, or if, for example, you're out in the suburbs and you're in a house and someone overdoses or something, and you happen to be just carrying a kit in your glove compartment of your car, at least you know you could run outside your house right away and you have a kit available to try and use for someone. So again, I am simply urging people to pick up these kits and help our emergency services out and make sure that we have these kits available for use if necessary. So everyone, please take care, be safe, be aware of your surroundings at all times, and everyone have a great day, and we'll talk to you again soon. Bye-bye.